Hi, I'm Michele McCormick. I'm a licensed clinical psychologist and I have a private practice in Newport Beach, California. I want to talk just a moment about addiction. And in particular, I want to talk to you if you think that you might be struggling with alcoholism or any other kinds of substance abuse or dependence. It's pretty insidious. And in the culture that I live in, drinking and using substances becomes part of a lifestyle. In fact, I had someone tell me that he's concerned that there's a whole generation of women in their 30s in our area in Orange County that are really just kind of giving themselves up to Chardonnay and shopping, other than you know, their families and their marriages. So here's the deal: if you are concerned that you're getting stuck and unable to stop drinking or using substances, then it's possible that you have a problem and that you need some support and some help. And I would like to be here to help you do that. There's a screening instrument on my website called the MAST that you can take, answer a few questions, and sort of get a feel for whether or not you actually have a problem. If so, come on in and let's talk about it. Let's just explore it. I also have worked with professionals, psychologists and therapists who have struggled with chemical dependency and substance abuse. If it's affecting your marriage or your significant relationships, if it's starting to impact work in a way that concerns you, even if you're just thinking maybe possibly. Now, if you have a DUI, or have you gotten one, have you gotten involved in some behaviors that you probably wouldn't have done if you hadn't been using or abusing, then you may need to talk to someone. So anyway, I'm here to do that, and I also would like to work with family members. If you're a child and you're on the internet right now looking for, or an adolescent, or even a spouse, maybe a sibling, maybe it's your brother, your sister, someone you're deeply concerned about, and you want to know if they have a problem, and you want to know if they can get some help. Family members often need a lot of support with an individual who either acknowledges that they have a problem and gets treatment, or with someone who's not acknowledging it and is sort of in denial. But we can help you, I can help you decide how best to move forward. And usually we do that with intervention. So I'd like to just talk a little bit to folks who are in chemical dependency and recovery work, treatment professionals, just to let you know what I like to do. I like to work with the recovery community to provide sort of a seamless system of care, and I like to call it wraparound treatment paradigm, you know, where I work with an interventionist ahead of time so that I am ready to receive family members if an intervention is done and someone has to go straight into a medical detox. I like to talk to the detox docs. I like to talk to the residential treatment center therapists or treatment planning folks. And I like to be a part of someone's aftercare program. I really want to help people plug into a 12-step program in their neighborhood, in their community, and understand how that free, and particularly at this time in history, that free program that's grassroots, and it's amazing support for folks who are struggling with addiction. And I'm not just talking about substances either. You know, I'm talking about internet, I'm talking about pornography. There's so many kinds of things that can pull us away. And often we want to ask the question, why are we doing this? Are we self-medicating something? Are we covering something that we really need to be looking at and trying to understand and gain some insight on? Maybe it's something that feels too painful to take a look at, and so we're using substances or an addiction to sort of run. So let me help you out. Come on in. Let's talk about it. Let's get you back on track, and let's move you into a quality life for yourself and for your family. Thank you very much.